It looks like we have somebody trying to connect still. It's Brooke. It is Friday, February 14th, 2:11 p.m. We are in public session of the OVMEB Medical Examining Board, and we are reconvening to discuss a couple matters. And I'll just do a quick roll call so we know who we have back in the room. Director Burns.
Here.
Thank you. Investigator Holland.
Here.
Investigator Graho.
Here.
Inspector Nye.
Here.
Licensing Administrator Brooke Walker.
Here.
AAG Joanna Tucker Davis.
Here.
Board members, Dr. Reagan Borzak.
Here.
Dr. Allison Lamb is here. Dr. Brett Hamilton is excused. Natalie Mayer Williamson.
Here.
Thank you. Karen Pate.
Here.
Dr. Katie Wallace.
Here.
Thank you. Brian Wadika. Oh, did we lose Brian? We can see him, Brian. He is here and showing here.
Oh, sorry, present.
No worries. Dr. Max Rinaldi.
Present.
Thank you. So we have quorum for voting purposes later. And Director Burns, do you want to introduce a couple things that were brought up that need to be discussed in public session today as follow-up?
Yes, thank you. Brooke, sorry, can you enable sharing again in this meeting? So this is an item that was sent for public comment, and we didn't review it because there were so many other there's other people there providing comments, and this just got overlooked. So I'd like to just review it. The person that submitted this was not at the meeting, and so I think it's okay to review this here. Sorry, I'm just trying to get it up on screen.
Hang on, Pete. It's not allowing me to switch for some reason on this one.
It's saying I can here.
Oh, okay. Look, I don't have the capability to change it.
For board members, if you'd like to follow along, it's in your packet under public session, public comment, item 4. It's the email in there.
Okay, so this person sent this email with a lot of links about the issue of needing a prescription to purchase pet food, and then provides a bunch of links. Talk about a class action lawsuit, and we can open those and look at those links, and basically saying like the board to consider this, what we might be able to do for pet owners in Oregon. Now, I don't know exactly what the issue is. We have prescription dog food. It's a more of a, as I understand, more of a marketing operations decision than it is an actual prescription. But I don't know if the board wants to look at this or has concern about prescription dog food or prescription pet food, or any other thoughts on this.
I'm just curious of what authority we would have. My understanding is that it's regulated by the FDA under the Center for Veterinary Medicine. So
I don't think we have much jurisdiction here. You know, the most we could do is communicate something to the public and licensees. If there's something to communicate, we could refer to other agencies. But yeah, I'm not sure what real action we can take here. But someone sent it along, and I want to make sure the board saw it.
Pete, I have 2 questions. Is Brooke able to share with us anything about the call that she took from this individual, or is it pretty much captured in this email?
It's captured in this email.
Okay, and then my other question is, should we just reach out to this individual because they were asking for a slot to speak to the board and just say, you know, we didn't see you at this meeting. If you'd like, you know, to make public comment on, you know, our next meeting is April, and just hear this person in April. And if they don't show up in April, then, you know, kind of just take the information and sit with it because I don't know exactly what they're asking.
Sounds like a fair suggestion.
Do we have any other board members feeling like they want to ask more questions right now, or just have, you know, Pete or one of the staff members reach out to this individual to just ask if they want to make their public comment in April? Dr. Borzek?
Yeah, I think I don't really understand what they're asking. So I think more information directly from them, either with them coming to the meeting or giving information that can be conveyed, would be helpful for me to understand what their concerns are.
Thank you. Natalie?
I think so too. I mean, is she asking for us to say something about not having a prescription for dog food? I guess more information would be good.
Thank you. Karen?
Yeah, I'm not sure what this person is asking us to do. So yeah, I agree.
Dr. Wallace?
I felt the same way. I couldn't tease out what their exact question is. And my understanding is the reason their prescription is that they are limited in certain things or have other ingredients out of proportion to what is considered a normal maintenance diet. So I don't fully understand this person's question.
Okay. Brian?
I have nothing right now other than if they want to, you know, join the next meeting and provide more input, please do so.
Thank you. Dr. Rinaldi?
I agree. I think same as everyone else. I don't really know what they're asking.
Okay, sounds good. Thank you. So we'll just wait and hear from this person at another time. And then moving on, would it be best, Pete, for me to hand this?
To make sure that, you know, yep, sounds good. We'll follow up on it. And then the other item we had was ICSB, and Ingrid was going to present some.
No, I don't think we were talking about that topic, Pete. I think
we're not. Let's not name names.
Excuse me.
Yeah,
thank you.
I think what we were talking about was just rules, not not anything involving. Yeah.
Yep, absolutely right.
So if this would be best, I can just turn it over to Inspector Nye to talk about some rules that you know, we wanted to discuss today.
Thank you so much. So what I've come up with here, you can hopefully everybody can see on the screen. Actually, I'll make it a little bigger. I know that's helpful. Oh, maybe that's too big. Hopefully everybody can see that. So playing off the excellent advice of Joanna Tucker Davis, we've got some definitions for pregnancy evaluation, sterility evaluation, and fertility evaluation here. And so I've got it up in the Word document so I can make changes as directed by the board.
Ingrid, did you not want to use the version I had sent you?
Oh my gosh, you're right. I'm sorry. This is the old one. Sorry, 1 second. Oh shoot. There it is. Okay. Sorry about that. It's got the same name, so I got confused. Well, I can't really see, but hopefully that will do it. Okay. And then I'll get large again. Okay, and it's a little expanded from here. But yeah, like I said, it's in the Word document version, so we can make changes. Has everybody already had a chance to look at this, or did it get dropped, or is this the first time we're all seeing it?
I think it's the first time we're seeing it. Can you reference the rule that this would be under?
Yes, I can. It is. It's under definition, so it's OAR 875-005-0005.
I know a lot of us don't go up there as much as other places.
Yeah. And actually, I think I can do this to kind of bring it together. Yeah. So we can see more of it all at once. Now I'll stop moving it. Sorry about that.
So what we're seeing on the screen here would be addition to the definition rules to add some more clarity around some definitions regarding pregnancy evaluation, sterility evaluation, fertility, and what those mean. And I think Dr. Rinaldi was the only one that wasn't here yesterday during the public session to hear also that there's some House bills, Senate bills that might be coming down the line that Glenn Kolb introduced to us too. So we, that also could be how we work through this too. So there could be some other changes, but today we're just looking at these rules and seeing if this is what we would maybe like to move forward with in the April meeting. And correct me, Ingrid, if I'm wrong about what would be the next steps. So like looking at these, seeing if it captures everything and then going forward.
Yes, so the board should just make a determination about whether you're all happy with the definitions as written, or if we want to do some tweaking right now, which we can definitely do. And then at that, if the board wants to move forward with this, then the thing to do would be to vote to move it to public rulemaking, like we did with the other rule during public session yesterday. So we could move that, and that would go to the same one, which would be, I believe it would be about March 21st.
So I'm gonna start out with Karen on this because Karen is the fabulous editor too. So sometimes she sees some word stuff that we all don't see from our different lenses. So let's start with the room with Karen.
Dr. Lamb, do you think we could get like 2 minutes just to read these? It would help my brain to just have quiet and be able to read through them really quickly.
Absolutely not. Of course you can. Of course.
Thank you.
More than
I
happy
could
to do
drop
that.
the document into the chat as well, so everybody could be looking at their own version. That would be helpful.
That would be super helpful because I know
Okay.
some people do appreciate scrolling. So how about we just take a few minutes and when you're ready, just put your hands up so I know, like your computer hands. Karen, would you like some more time with it, or do you feel prepared to chat about the rules? I don't want to rush anyone.
No, I'm good. I just put into the chat. I think those are just fussy things to make the style consistent with the style of the definitions above. I lined out a few words and capitalized and added a couple colons just so it matches the other definitions. But I think the gist of what they say is fine.
Thank you, Karen.
Uh-huh.
Dr. Wallace?
I felt like everything was fine, but the progesterone testing comment just needed to be progesterone testing. It didn't need to have the additional comment regarding eggs or whatever.
Great. I'm going to let them make the corrections. I'm going to let the staff make the corrections to the to what Karen's corrections were real quick, and then we'll pull that up and specifically look at it, because I feel like progesterone is captured in the sentence before it or the rule right before it, Dr. Wallace, and I want to capture what you're specifically talking about and see if maybe the egg information just should be changed, like progesterone should be struck and just testing to determine, because if there's
Right.
I apologize, I do a lot of spay and neuter. I don't look at a lot of reproductive tracks that are actually working anymore. So would that capture what you're going for? Just striking the word in C, striking the word progesterone, and just making that any testing. Oh, sorry, keep going. Under 27C, any testing to determine the number of eggs available for fertilization.
Oh, yeah.
Because progesterone's up above it in blood tests.
Right. Yeah.
Would that capture all of it?
Yes.
Awesome. Anything else, Dr. Wallace?
Nope.
Great. Brian?
No, I think it looks good, and the suggestions that have been made so far are good.
Thank you. Dr. Rinaldi?
I did have one question, and this might be redundant, but would it be worth adding verbiage to 25, 26, and 27, something to the effect of such examination and judgment constitutes a diagnosis for the purpose of this rule? I see Joanna shaking her head.
I think the concern is diagnosis is in another part of the definition of the practice of veterinary medicine. So, I mean, you can add that if you like, but you might be limiting what these words mean if you do that.
Gotcha. Okay. Yeah, in which case it just occurred to me that like I don't know. I'm not sure why I thought it sounded like a good idea, but if it's not, I'm happy to skip that.
Dr. Rinaldi, did that capture everything that you wanted to address?
Yep, in other respects, no, I think it all looks good. Thank you.
Thank you. Dr. Borzek?
Okay. I have a few thoughts. One, I'll just go in order. So pregnancy evaluation is defined as an examination and judgment concerning whether an animal is, and I'm wondering if we should put or is not gestating. We should add or is not in there. So thoughts about that. Sterility evaluation under A, 26A, I wondered if we should just put an examination to evaluate abnormalities in the reproductive organs, body condition, and overall health. I guess my thought is, or my concern is, and Joanna, maybe you can help with this. Sometimes I think with rules, if you're too specific, it can actually make it more difficult to enforce.
Sure. No, I think that, yeah, that I
So I was
think,
trying to make things a little broader.
yeah, that works.
So yeah, so where it said physical exam, I was just thinking an examination. Testing and evaluation of infections, human analysis to evaluate semen quality. And then under 27, fertility evaluation is defined as an examination and judgment regarding, I think we want to take out the condition of, because it doesn't read well. So regarding the animal's likelihood to conceive or beget offspring. This includes but is not limited to. And then here again, an examination was what I was thinking to keep it broad for A. Under B, I wonder if we should say blood tests to evaluate hormone levels and then not give examples to keep that broad. So you hormone levels to assess, or sorry, blood tests to evaluate hormone levels that assess reproductive cycle function. I agree with what was said earlier, remove C because I think it's captured up above, or change it because progesterone's already captured under hormones that assess reproductive cycle function. And then, oh, for E, thinking like any diagnostic to directly visualize and evaluate the reproductive organs, because there are other ways that you can directly visualize reproductive organs other than laparoscopy. The only other thing that, and I just did a quick search of the AVMA Model Practice Act, and they define infertility as well as all the ones that we've defined here. So I don't know if people feel like we should define that as well. I can tell you, so they say they call out pregnancy, fertility, sterility, or infertility. So they separate those out. Those are all my thoughts.
Thank you. Ingrid, do you mind going back up to the top again? After Reagan did that, was a few things that I saw, and then with Dr. Wallace's comment, I had a few concerns too about the use of words like sterility evaluation. I don't know if there's a way for us to say as it pertains to reproductive medicine sterility evaluation, because we could also be talking about sterility evaluation in another context, like the sterility of a surgical room.
Okay, so did you say as it pertains?
What if we directly reference the statute?
Sure, I love it.
Okay.
So as used in, is that ORS? I have to look it up. I don't remember.
Yeah, I'll look it up too. But what about pregnancy evaluation as used in whatever the ORS is?
Yeah,
And then colon, and then yeah. Yep.
I like it because I also think it helps people get back to the ORS when they need
I'll
to.
just put that in as a placeholder so we don't forget. There we go. And I'll fix that as soon as I have a chance to look that up. And then also here, right?
Yes.
Used in ORS. And then in terms of Dr. Borzik, your comment about defining sterility and fertility and infertility, I would need those definitions because I can't pull those out of my hat. So if you wanted to dictate something, I'd be happy to add it, or if you want to have more discussion first, that's fine too.
This is Joanna. The only concern, like right now, we're like defining the exact words in the statute.
Right.
So like how infertility, and I think the idea was that fertility evaluation includes infertility, right? Because it's the evaluation of. So I don't think you want
kind of,
yeah, I don't think you want to change the term that's being defined. That's the term in the statute.
okay, then
Yeah.
keep it, yeah, as fertility.
I did have one other word thing under 27. Beget is sort of a curiously biblical word there. I wonder if we could say conceive or bear offspring, conceive or give birth to offspring. I don't know if that gets messy with C-sections, but
I actually like it, Karen. I like that suggestion because I think it also takes into consideration size of embryo and structure of the animal.
Wait, so this is Joanna. So conceive, or what was the alternative words? I'm just capturing them. Produce
or give birth to offspring. Ingrid's captured it on the screen.
Oh, good. Okay.
Ingrid, my other comment, if we scroll down to 27B, is it says blood tests. If we could change that to lab tests, because I feel like anytime somebody comes up with a new test, they might be able to do it through urine or some other method, and then that could be a open-ended.
What if we just said diagnostic tests?
Sure. Should we just, I liked that until I read C and we said any testing. Can we just change it to any testing? Because I feel like people are skirting the word diagnostic sometimes with like what is a diagnostic versus a non-diagnostic test. And then that would go down to E, where we could say any testing to directly visualize. I just think that it's a clearer word to use.
Can we on directly, can that be directly or indirectly?
Here?
Yeah.
Would it be better just to get rid of the word directly?
You can just say any testing to visually visualize and evaluate the reproductive organs.
Would that imply vision as in seeing with your eyes as opposed to with a diagnostic tool of some sort, a CT or an ultrasound? Or
would it be helpful to say any testing or imaging to visualize? Would that capture what you're going for, Dr. Rinaldi?
Is that really a test though? I'm not sure testing is the right.
Is imaging the better? Any imaging?
Well, but you could directly visualize, and that wouldn't be imaging. That would be using your eyes.
Any examination or imaging? What were you saying, Dr. Rinaldi?
Originally, it included laparoscopy. I don't want to exclude that by adding imaging.
Do you want to say any direct visualization or imaging to evaluate the reproductive tract?
Sure, I'm fine with that.
Could you repeat that? Any direct visual, what was it?
Yeah, I said it and then I forgot it.
Visualization or imaging
To evaluate. Okay.
Does that, I guess that would include necropsy if never mind, sorry. Just thinking out loud.
No, it's good. Everybody's good thinking out loud. This is great. As things are hitting you, board members, just unmute yourself and then we'll do like a final check from top to bottom. Karen, since we're modeling this after the other definitions, but we're adding in the ORS to this, do we need the word is an examination or an examination is okay? Or do we need some sort of punctuation like the colon needs to go after the ORS?
I think it's okay. I think it's okay since that's the pattern that you've established before above.
Okay, I just didn't know if it got convoluted with the ORS in there.
I'm wondering if for, oh, sorry. Go ahead,
I
Karen.
think it's okay, but if anybody else is confused, speak up.
For 26B, I'm wondering if we want to say testing and evaluation of the reproductive tract, because you could theoretically test the reproductive tract and evaluation of infections, right? Like the tract might not be infected. Do you see what I'm getting at? You're looking to see that you could be looking to see that it isn't infected, for example.
Would it be all testing and evaluations of the reproductive tract?
Is that too broad, do people think?
Board member thoughts?
I don't think it is because it is the 26 limits it to the assessment of the ability to produce offspring.
This is Joanna. What about testing and evaluation of the ability of the reproductive tract to produce offspring? Just like restating what you just said?
But I think we would also have to say also incapable of producing offspring. So it would be both sides, because really, I think what we were going for in adding that was the infection part, which would mean you'd have to clear the infection before you could reproduce.
What about testing and evaluation of the ability of the reproductive to produce or not produce offspring? I mean, it's a little wordy, but
Is that necessary though? I mean, what else would the reproductive tract be used for? If you were gonna test the bladder, you'd be testing it to produce urine, right? I mean, I'm just wondering if that's necessary.
Dr. Rinaldi made a good point too about the fact that it is a subsection of this where we're specifically saying it's about capable or incapable of producing offspring.
Yep.
I sort of like keeping it simple because I think we're going for the big things, which is finding any abnormalities, testing for the evaluation of it. And if we wanted to add anything, I'd say just for the overall health of the reproductive tract and semen analysis, but I like it where it's at right now. Any other board members? I don't want to, Natalie, I haven't heard from you in a little bit. How are you feeling?
Very good. I think all the changes are excellent. And I don't have much to add. Everybody kind of throws in stuff every time I think of something. So.
Thanks. Brian?
Nothing at this point to add.
Okay. Dr. Wallace?
I like the changes we've made.
Dr. Rinaldi?
It looks good, thank you.
Thanks. Dr. Borzik?
Yeah, it looks good.
Karen?
I think it looks good now.
All right. Does anybody want to go through a top to bottom, or I feel like we can see everything on the screen there, or most of it. Just head up to the top there. Can you make it just a little smaller, Ingrid? Maybe we can get it all on the screen and people can read through it real quick. Not that I like smaller.
Oh boy, that's too small. Let's see. Maybe like, let's try 140. Oh, that's too high. Almost. Oh, we did it. Yay.
Hey.
Are we looking at the chat? I'm not seeing.
Can you not see it on the screen, Joanna?
It could be me. Like I'm seeing people really big.
Oh,
Maybe it's my view.
interesting. Yeah, we can see it and then we're all on the side.
Okay. Huh. Well, don't worry. That's okay.
Joanne, I just screen capped it and I'll send it to you so you can look at it.
Thank you.
So Ingrid, remind me if we have this right now. Are we saying that we can vote on this or we can't
Yeah.
vote on it?
Someone could make a motion to move this to public rulemaking, and then the board could vote on it.
I so move.
So Dr. Wallace moves to
I'll second that.
and Karen seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Hi.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Aye.
Dr. Lamb, aye. Motion passes to move forward with rulemaking on, do I need to state the ORS or because we have it on the screen, we're good.
You could state it, but I think it was clear that since we named it as we were discussing it.
Okay.
Yeah.
All right. Do we need anything else on that matter?
I don't believe so. Thank you. That was really, really easy. You all made it great. Thank you.
Thanks for doing the work, Ingrid, and whoever else helped with that.
All right. I'm glad that we were so efficient today on that. I would like to move into voting, voting on what we've discussed in executive session, unless there's anything else, Director Burns, that you feel like we need to do first. All right. Is everybody ready? Everybody's got their files open and they're, just takes me a bit to rearrange here. Hold on. And some of these are going to be lumped and some of them are going to be separate. I'm just going to read them as we've got them because sometimes it's harder to lump them afterwards versus in a moment. So, all right, I, Dr. Allison Lamb, moved 24-0028, 2024-0029, 2024-0032, 2024-0041, 2024-0057, 2024-0094, 2024-0135, 2024-0148, 2024-0157. Do I have a second?
I'll second.
Dr. Rinaldi seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Ryan? Dr. Lamb, aye. Motion in favor, Dr. Borzik?
Aye.
Dr. Wallace?
Number again.
Absolutely. It's 2023-0076A.
I'm not finding it real quick in my
Do you
note.
want me to give you it's 1D for the executive director and AAG under the executive session, if that's helpful for reference.
Okay. Aye.
Um, Brian,
Aye.
Dr. Rinaldi,
I think I was absent for this one, so abstain.
okay. Dr. Rinaldi abstains. Dr. Borzik, sorry, you already went, right? Okay, and Dr. Lamb is aye. So motion passes. In 2024-0052, I, Allison Lamb, move to withdraw notice of proposed discipline and close the case. Do I have a second?
Second.
Dr. Wallace seconds. All those in favor, Dr. Borzik?
Nay.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Nay.
Dr. Rinaldi?
Oh, abstain.
And Dr. Lamb, aye. Can I get a count of the votes? I believe that was 4 aye,
2 nays and 1
2 nays.
abstain.
So it does not pass. In case 2024-00, hold on, I'm just gonna make a quick. Okay. In 2024-0080, I, Allison Lamb, move to withdraw the notice and close the case. Do I have a second?
I second.
Dr. Borzik seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Abstain.
And Dr. Lamb, aye. Motion passes. In case 2024-0073, I, Allison Lamb, move to offer a settlement with 1-year probation and a $500 fine. Do I have a second?
I'll second.
I have Dr. Borzik seconding. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Abstain.
Dr. Lamb? Aye. Motion passes. In case 2023-0169, I, Allison Lamb, move to accept the settlement offer. Do I have a second?
I'll
Second.
second.
I got Brian in there just a little bit first. All those in favor, Dr. Borzik,
Aye.
Natalie,
Aye.
Karen,
Aye.
Dr. Wallace,
Aye.
Brian,
Aye.
Dr. Rinaldi,
Abstain.
Dr. Lamb, aye, motion passes. In 2025-0022, I, Allison Lamb, move to approve for the VT&E. Do I have a second?
I'll second.
Natalie seconds. All those in favor, Dr. Borzik,
Aye.
Natalie,
Aye.
Karen,
Aye.
Dr. Wallace.
Aye.
Thank you. Brian,
Aye.
Dr. Rinaldi.
Abstain.
Thank you. Dr. Lamb, aye. Motion passes. In case 2024-0098, I, Allison Lamb, move to close the case. Do I have a second?
I'll second.
Natalie seconds. All those in favor, Dr. Borzik,
Sorry, I'm just catching up. Can you give me 1 second?
absolutely.
Yes. Aye.
Okay. Natalie,
Aye.
Karen,
Aye.
Dr. Wallace,
Aye.
Brian,
Aye.
Dr. Rinaldi,
Abstain.
Dr. Lamb, aye. Motion passes. 2024-0017, I, Allison Lamb, move to close the case. Do I have a second?
I second.
Karen seconds. All those in favor, Dr. Borzik,
Aye.
Natalie,
Aye.
Karen,
Aye.
Dr. Wallace,
Aye.
Brian,
Aye.
Dr. Rinaldi.
I'm sorry, did you say 2024-0017?
Yes, I did.
Okay, thank you. Abstain.
Thank you. Dr. Lamb, aye. Motion passes. In 2024-0037, I, Allison Lamb, move to close the case. Do I have a second?
I'll second.
Natalie seconds. All those in favor, Dr. Borzik,
Sorry, my order is so different. Aye.
thank you. Natalie,
Aye.
Karen,
Aye.
Dr. Wallace,
Aye.
Brian,
Aye.
Dr. Rinaldi,
Abstain.
Dr. Lamb, aye. Motion passes. In case 2024-0056A and B, I, Allison Lamb, move to close the case. Do I have a second?
Second.
Brian seconds. All those in favor, Dr. Borzik,
Aye.
Natalie,
Aye.
Karen,
Aye.
Dr. Wallace,
Aye.
Brian,
Aye.
Dr. Rinaldi,
Abstain.
Dr. Lamb, aye. Motion passes. In 2024-0126A and B, I, Allison Lamb, move to close the case. Do I have a second?
I'll second.
Natalie seconds. All those in favor, Dr. Borzik,
Aye.
Natalie,
Aye.
Karen,
Aye.
Dr. Wallace,
Aye.
Brian,
Aye.
Dr. Rinaldi,
Abstain.
Dr. Lamb, aye. Motion passes. Can somebody confirm that that was 0126A and B? Okay, just making sure. Sorry, I'm looking at two lists. In case 2023-0012, I, Allison Lamb, move to close the case. Do I have a second?
I'll
Second.
second.
Brian got in there first for the second. All those in favor, Dr. Borzik,
Aye. And I should have recused myself on the last case, 0126. Sorry. My numbers got mixed up.
okay, let's finish the vote out on this one and we'll go back to that one.
Okay. Aye.
So your aye for 2023-0012, correct? The one,
Correct. Yes.
Natalie,
Aye.
Karen,
Aye.
Dr. Wallace,
Aye.
Brian,
Aye.
Dr. Rinaldi,
Abstain.
Dr. Lamb, aye. Motion passes. Going back to case 2024-0126AB, I would like to move to remove the vote previously voted and move to close, or how do we do that, Joanna? We just need to do a new vote count because Dr. Borzik wanted to recuse.
Oh,
Or what, I mean, I was not involved in the case, so I should not vote. So abstain or like
yes.
I
So
recused myself.
let's,
Sorry.
you know what? Let's just take a revote and let's see what happens.
Okay,
Yeah.
so we're gonna do a revote on 2024-0126A and B. I, Allison Lamb, move to close the case. Do I have a second?
Second.
Brian seconds. All those in favor, Dr. Borzik,
Oh, abstain. Is that what I should say, Joanna?
Yes.
Abstain.
Natalie,
Aye.
Karen,
Aye.
Dr. Wallace,
Aye.
Brian,
Aye.
Dr. Rinaldi,
Abstain.
Dr. Lamb, and that passes, right?
Yeah. Yes.
Okay, yeah, we have enough.
Yeah, I got 6 people voting yes to close.
Okay.
Yeah.
Okay. So that was 2024-0126A and B. We have voted on 2023-0012. So we're moving on to 2023-0083A. I, Allison Lamb, move to issue a proposed $250 civil penalty and cost for a violation of OAR 875-011-001032. Do I have a second?
Second.
Brian seconds. All those in favor, Dr. Borzik?
Are you naming more violations after this? Or was that all of them? For A through D? Or was that
That was just for A.
I will
Oh,
be
just for
doing
A. Thank you.
individuals
Okay.
yes, that was just for license.
Oh, you're gonna name them each
Yes.
individually. Great. Got it. Okay. Yep.
Thank you. Natalie,
Aye.
Karen,
Aye.
Dr. Wallace,
Aye.
Brian,
Aye.
Dr. Rinaldi,
Abstain.
Dr. Lamb, aye. Motion passes. In the case of 2023-0083B, I, Allison Lamb, move to issue a proposed $250 civil penalty and cost for a violation of OAR 875-011-001032. Do I have a second?
Second.
Dr. Borzik seconds. All those in favor, Dr. Borzik?
Aye.
Natalie,
Aye.
Karen,
Aye.
Dr. Wallace,
Aye.
Brian,
Aye.
Dr. Rinaldi,
Abstain.
Dr. Lamb, aye. Motion passes. In the case of 2023-0083C, I, Allison Lamb, move to issue a proposed $250 civil penalty and cost for a violation of OAR 875-011-001032. Do I have a second?
I'll second.
Natalie seconds. All those in favor, Dr. Borzik?
Aye.
Natalie,
Aye.
Karen,
Aye.
Dr. Wallace,
Aye.
Brian,
Aye.
Dr. Rinaldi,
Abstain.
Dr. Lamb, aye. Motion passes. In case 2023-0083D is in dog, I, Allison Lamb, move to issue a proposed $250 civil penalty and costs for a violation of OAR 875-011-001032. Do I have a second?
Second.
Brian seconds. All those in favor, Dr. Borzik?
Aye.
Natalie,
Aye.
Karen,
Aye.
Dr. Wallace,
Aye.
Brian,
Aye.
Dr. Rinaldi,
Abstain.
Dr. Lamb, aye. Motion passes. In the cases of 2023-0083E and F, I, Allison Lamb, move to close the case. Do I have a second?
I'll second.
Natalie seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Darren?
Aye.
Dr. Wallace?
Do we say close with the letter of education? Or just close?
Joanna, advice?
I think it's fine to say letter of education if that's what you want to do. Sure.
Do I need to restart the vote?
Probably should. Yeah.
Okay, no problem. In cases 2023-0083E and F, I, Allison Lamb, move to close the case with letters of education. Do I have a second?
I'll second.
Natalie seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Darren?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Abstain.
Dr. Lamb? Aye. Motion passes. In the case of 2023-0083G, I, Allison Lamb, move to issue a proposed $100 civil penalty and cost for a violation of ORS 686.0201 Do I have a second?
Second.
Brian seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Rinaldi?
Abstain.
Dr. Lamb? Aye. Motion passes. In the case of 2023-0083H, I, Allison Lamb, move to issue a proposed $100 civil penalty and cost for a violation of ORS 686.0201 Do I have a second?
I'll second.
Natalie seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Darren?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Abstain.
Dr. Lamb? Aye. Motion passes. In case 2024-0001A and B, I, Allison Lamb, move to close the case. Do I have a second?
Second.
Brian seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Abstain.
Dr. Lamb? Aye. Motion passes. In the case of 2024-0031, I, Allison Lamb, move to close the case. Do I have a second?
Second.
I think that was Brian. Brian? All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Abstain.
Dr. Lamb? Aye. Motion passes. In the case of 2024-0036, I, Allison Lamb, move to issue a proposed $500 civil penalty and cost for 2 violations of ORS 875-015-00302, little f, capital S as in Sam, capital Q as in Queen, and 875-015-00302, little c. Do I have a second?
Second.
Natalie seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Abstain.
Dr. Lamb? Aye. Motion passes. In case 2024-0039, I, Allison Lamb, move to close the case. Do I have a second?
Second.
Brian seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Sorry, we didn't capture the full. Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Abstain.
Dr. Lamb? Aye. Motion passes. In 2024-0045, I, Allison Lamb, move to close the case. Do I have a second?
Aye.
Natalie seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Abstain.
Dr. Lamb? Aye. Motion passes. In case 2024-0053, I, Allison Lamb, move to close the case. Do I have a second?
Second.
I think that was Brian again. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Abstain.
Dr. Lamb? Aye. Motion passes. In case 2024-0081, I, Allison Lamb, move to close the case. Do I have a second?
Second.
Brian seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Abstain.
Dr. Lamb? Aye. Motion passes. In the case of 2024-0105, I, Allison Lamb, offer a settlement agreement with $500 civil penalty, which will be waived with successful completion of a board-approved course and legal requirements regarding medical records for a violation of OAR 875-015-00302, little f, capital N, and capital S is in Sam. Do I have a second?
Voted for him because I want cheaper gas. And
Second.
Ingrid, can you mute, please? Sorry. I'm sorry, who second?
Second.
Brian seconds. All those in favor, Dr. Borzik?
Nay.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Abstain.
Dr. Lamb, aye. Joanna, motion passes?
I counted enough to pass, yeah.
Okay, motion passes. In case 2024-0088, A, B, C, and D, I, Allison Lamb, move to close the cases. Do I have a second?
I'll second.
Dr. Rinaldi seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Aye.
Dr. Lamb, aye. Motion passes. In the case of 2024-0088E, I, Allison Lamb, moved to issue a proposed $250 civil penalty and cost for a violation of 875-015-00302, little f, capital T as in Tom. Do I have a second?
Second.
I'll second.
Dr. Borzik seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Aaron?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Aye.
Dr. Lamb, aye. Motion passes. In case 2023-0114, I, Allison Lamb, move to close the case. Do I have a second?
I'll second.
Karen seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Rinaldi?
Aye.
Dr. Lamb, aye. Motion passes. In the case 2024-0025, I, Allison Lamb, am recused from this case and was not present during the discussion. Is there a motion for this case?
I move to close this case.
Thank you. Do I have a second?
I'll second.
Ooh, I heard Natalie a little louder on that one for the second. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Aye.
Dr. Lamb is recused. Motion passes. In case 2024-0035A and B, I, Allison Lamb, move to close the case. Do I have a second?
I'll
Second.
second.
Natalie was louder on the second on that one. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Aye.
Dr. Lamb, aye. Motion passes. In the case of 2024-0107, I, Allison Lamb, move to close the case. Do I have a second?
I'll second.
I think I heard Karen in there seconding. Was that right, Karen?
Mm-hmm.
Okay. Karen seconds. All those in favor, Dr. Borzik?
Aye.
Dr. Sorry, Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Aye.
Dr. Lamb, aye. Motion passes. In the case of 2024-0108, I, Allison Lamb, move to close the case. Do I have a second?
I'll second.
Natalie seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Aye.
Motion passes. Or Dr. Lamb, aye. Motion passes. Was that 108? Sorry.
Yeah.
Yeah.
In the case of 2024-0132, I, Allison Lamb, move to close the case and send a letter of education. Do I have a second?
I second.
Dr. Borzik seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Aye.
Dr. Lamb, aye. Motion passes. In case 2024-0138, I, Allison Lamb, move to close the case. Do I have a second?
A second.
Karen seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Aye.
Dr. Lamb, aye. Motion passes. In the case of 2024-0140, I, Allison Lamb, move to close the case. Do I have a second?
I'll second.
Dr. Rinaldi seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Aye.
Dr. Lamb, aye. Motion passes. In the case of 2024-0144, I, Allison Lamb, move to close the case. Do I
I
have a
second.
second? Natalie seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Aye.
Dr. Lamb, aye. Motion passes. In the case of 2024-0156, I, Allison Lamb, move to issue a proposed $750 civil penalty and cost for violations of OAR 875-011-00107, 9, and 11. Do I have a second?
I'll second.
Natalie seconds. All those in favor, Dr. Borzik?
Aye.
Natalie?
Aye.
Karen?
Aye.
Dr. Wallace?
Aye.
Brian?
Aye.
Dr. Rinaldi?
Aye.
Dr. Lamb, aye. Motion passes. This concludes our voting for today. Wow, that's all I can say. Good job, everybody. This was a very, very productive meeting, both in board cases as well as public information, public attendance, and a great way to start off 2025. Definitely screaming in the new year. So, Director Burns, anything additional that you'd like to add today?
Not at all. Just second everything you said. We got a lot done. I really appreciate it. Everybody's been a long couple days. Really appreciate everybody's concentration and clearing these cases, especially, and getting through some really important stuff in public. And in April, we're going to have our in-person meeting, as I said, which I'm really excited about. I'll reach out to you for details on that. But if you can make it into Portland, We'll take care of those who need hotels and transport and all that. But we'll get together in April in person, which will be fantastic, and we'll just keep things moving. So thank you all so much.
Thank you, everybody. Have a lovely long weekend if you're getting a long weekend this weekend with the holiday. And I know Dr. Wallace is just laughing. There's no long weekends in large animal medicine, but I appreciate all of you large animal medicine people out there working really, really hard on everything. So please take care of yourselves, and we'll see you in April.